My name's Dr. Jennifer Stinson. I'm a nurse clinician scientist at the Hospital for Sick Children. I'm a nurse practitioner in the chronic pain program, and I'm also a professor in the Lawrence S. Bloomberg Faculty of Nursing and the Institute of Health Policy Management and Evaluation at the University of Toronto. What my research and clinical areas are that I'm being recognized for is my work with young people with chronic pain. Chronic pain affects 1 in 5 children and adolescents in Canada, and it's often undertreated because healthcare professionals lack the training and education in pain. 70% of the time I do research, and 20 to 30% of the time I'm spent caring for children in the pain clinic with chronic pain. I love my job. I'm so passionate about it because every day I come to work, I see patients and families. I can address the questions that are so important to them through my research. So what I do in my lab is try to use digital therapeutics and virtual care solutions to improve access to care for young people that have painful chronic conditions. Because I'm embedded in a hospital and I work clinically with these patients, I can get my technological interventions embedded back into clinic so a generation of kids are not losing out on research that's been done. Two other things that are really important to me as my role as a health clinician scientist is, one, training the next generation of nurses and other non-physician scientists, and then is a program that we've developed called Project Echo. And Project Echo is really about using the expertise that we have here at Sick Kids to help those in primary care feel more comfortable and confident to care for medically complex children that we're seeing now that have chronic pain, that are palliative, that have complex medical care needs. We have a whole bunch of evidence that these tools we created work. So now what my team's doing is actually looking at implementation science methods. So how do we get these tools embedded in everyday clinical practice, whether that's in primary care or whether that's in a hospital such as Sick Kids, so that young people can benefit from these technologies and they're not just sitting on the shelf. I'm humbled to get this award. It recognizes my role as a nurse clinician scientist, where I'm embedded in clinical practice and I'm trying to address the questions that are most important to patients and families. I think the other reason this award is so important is it shines the spotlight on pain in children. That pain in children is common, that it's undertreated, it's underrecognized, and that it's an important avenue of research to help develop digital solutions to help alleviate the suffering and pain that these children have.